Welcome to Gamble with Brandl. Today we have a patient with epilepsy, and the patient presents with depressed mood, psychomotor agitation, feelings of guilt, and significant weight loss over a period for more than 2 weeks. Patient has also trouble sleeping and doesn't sleep for more than 4 hours a night. Which of the following drugs would be beneficial for this patient? So what does this patient have? What are we dealing with? Depressed mood, psychomotor agitation, feelings of guilt, weight loss, also trouble sleeping. That sounds like major depression. And let's think about if we identify any antidepressants on this list here. What are these different drugs? Bupropion is an NDRI, a norepinephrine dopamine reuptake inhibitor, very famous antidepressant. Fluoxetine, an SSRI, also an antidepressant. Mirtazapine, also an antidepressant. This is one of these atypicals. It's a serotonergic antagonist, also an alpha-2 antagonist. Olanzapine is a second generation antipsychotic. And lithium is a very famous drug for bipolar disease. So bipolar, you have signs of depression, but also mania. So from these lists, we can already exclude some which are not antidepressants, but we still have 3 as an option. So we need now to look at the past medical history and also the symptoms of the patient, because in the end for antidepressants, really they're all quite equally effective, and you have to decide based on your patient, based on the past medical history, and based on the adverse effect, what would fit best. So what do we know about bupropion? Well, bupropion has 2 very, very important absolute contraindications, and so bupropion cannot be taken in a patient with underlying seizure disorder, and also not in a patient with underlying eating disorder. Why? Because dopamine increases the seizure threshold, and this drug is gonna let less dopamine in because the dopamine reuptake inhibitor, so you have more dopamine around. So we have here an absolute contraindication, CI for contraindication for patient with seizure disorder. And if you look at our patient, well, the patient has epilepsy, so this drug is out. I also want to mention that bupropion leads to significant weight loss, which is sometimes used, sometimes beneficial for a patient that gained a lot of weight. But here we have already weight loss, so you don't want to get something, takes another drug that have the patient even lose more weight. Now, fluoxetine and SSRIs are very popular antidepressants, so definitively something we could think about. But the problem with fluoxetine, it's one of the most activating SSRIs. Also, you cannot give this drug after 11 a.m., for example, so that patient doesn't sleep. That makes it a less beneficial choice. So there's also a mnemonic that says fit with fluoxetine because it's so activating. Let's put this also down. So that's not ideal for this patient because the patient already can't sleep. So let's take this also out. So what about mirtazapine? It's one of these atypical antidepressants that has significant H1 antagonism as well. And therefore, whenever you see H1 antagonism, that tells you that this drug makes you more sleepy and also gain weight. So weight gain and sedation are adverse effects. But for this patient, if you're looking at this, the patient already lost weight and also can sleep, so making this as a pretty attractive choice here. So mirtazapine as our atypical antidepressant would be a good choice for this patient because bupropion is out because of the history of epilepsy, and fluoxetine is not ideal because it's so activating, and it really is gonna not really help this patient to sleep, and this patient has already trouble sleeping. making mirtazapine here the best choice.